This is Krista Michener. Welcome back to Made to Be Whole. This week, we are going to discuss strategies for managing and hopefully eradicating chronic pain. Stay tuned. Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. Welcome back to Made to Be Whole. Let's talk about pee. If you don't know what that is, you will. It comes to afflict most of us at some point, but it's so disabling. That's the very difficult thing about pain. I have a memory that's always stuck with me. One of my aunts, the whole time I knew her, it was my dad's oldest sister. It was difficult for her to get around, and she was really kind of grouchy a lot of times. But after I got older, I realized pain must have made a huge impact on that. And I had a really neat experience after she passed away. I was at a church service and I remember just having this overwhelming feeling that she was so happy because she was free from pain. It just washed over me. It was a really beautiful feeling, but it made me put in perspective, how do we feel, even if you're not someone who has chronic pain, if you have acute pain, if you have a severe headache for a day or you sprain an ankle, or especially think stomach pain, what that'll do to you, it's really hard to be your jolly best. You don't have a lot of energy. It takes a lot out of you. Everything's harder. And I think having compassion for the people in your life who are dealing with that, of course, if you're suffering from pain, you still do your best to have a positive outlook and not be a miserable person to be around. But it really, really does impact people emotionally as well as physically, and can impact relationships. And it's difficult for people who have pain too, because a lot of times activity's limited and they can't do the things that they used to, or do them in the way they're used to doing. And so we need to have compassion for that. But we got to thinking a few weeks ago, there are a lot of really cool things that we do at our office for pain, and we're tying them together into a pain management package that's going to be available starting at the first of the year. But I wanted to go through them because these principles can apply to anyone, anywhere, no matter what your resources are. The key features of it are all R's. I love my alliteration. We have our four I's. Now I have my R's, but these are all R's. Reducing inflammation, replacing nutrients, removing toxins, repairing damaged tissues, restoring blood flow, retraining the brain, rewiring pain pathways, and relearning how to eat and move. So the way our package is going to work is we're going to start with some preliminary labs, but these are things that you can request from your provider, or there are, thankfully now, a lot of places where you can self-order labs if you self-pay, like any lab test now. If you just put in your search engine, self-pay labs near me, a lot of things will come up, places where you'll go online and you'll say, I want these things checked. And then you put in your zip code and they'll ring it up, you'll pay. And then you take that to the Quest or the LabCorp, the CompuNet, whatever is closest to you that they've contracted with. So it's a pretty cool option for getting some of these basic markers. I think it's always important to check a CBC, which is a complete blood count, a metabolic panel to look at liver, kidney function, looking at lipids, iron and ferritin. So iron is iron. It's what it sounds like. Ferritin is your body's iron stores. So I always say iron's what's on the shelf and ferritin's what's in the cellar. Inflammatory markers. So these would include C-reactive protein, a sedimentation rate. All that means those are markers in your blood that when there's a lot of systemic inflammation, they can be higher. So that's something to have a good baseline of. Looking for autoimmune issues like an elevated ANA. Homocysteine is a really important marker. When you have high homocysteine, you have more inflammation in your blood vessels. So even though a lot of times we think of pain as either neurological or muscular or skeletal, those are kind of the main areas people think of as far as chronic pain. If you have vascular inflammation, so if you have inflammation in your blood vessels, that's going to restrict blood flow, which is going to make your pain worse. Um, Fibrinogen is a marker that looks to see if there's excess fibrin in your body that can, again, occlude your blood vessels, do other things that just make everything harder to work, reduce blood flow. We'll look at people's hormones. I've mentioned this before, but hormone deficiencies can have a huge impact on pain. Low testosterone and low estrogen, especially. But I think getting a good testosterone and DHEA for men, for women, you do testosterone, DHEA, progesterone, and estradiol, which is E2, a form of estrogen. We're gonna ask all of our patients to get one of the who do the pain program to get one of the micronutrient panels that we've talked about in previous episodes. I have had patients who have had extreme reductions in pain because we figured out either they were really low on a whole host of B vitamins specifically, they were low on amino acids that were really important for circulation and nitric oxide, or, because sometimes it's everything, they're really low on antioxidants. So if you're like bottomed out on alpha lipoic acid and cysteine and glutathione, your body's not going to be able to take out the trash. And so some of your pain's just going to be because of that heavy toxic load. I think it's also important, and we're gonna make this part of the program too, to check for toxins. There is a company that does a total tox burden, but the main toxins you're looking at are mycotoxins, which are mold, depending on your living situation. Heavy metals are, it's not uncommon. It's not common, but it's not uncommon for people to have higher levels of heavy metals, which can contribute to pain. That can come from a work environment. If you have mercury fillings, some people will have elevated mercury levels. An OAT test, so that's an organic acid test, which is a urine test, can give us a really, really good picture of different toxins that you're clearing that may come from, sometimes we find it's like pesticides in the area you live. People who live near fields that are being sprayed tend to have more health problems. And then the last thing that is nice to check for someone who has really severe chronic pain that hasn't budged is checking the health of their water to see if there are glyphosates in their water, because that is an easy fix. You drink bottled water, and it can really, really impact your health. So those are kind of the base things. Obviously, there are some people who may need additional testing if we suspect that infection is contributing, but a lot of people who are being treated for chronic pain outside of the world of functional or integrative medicine, there hasn't been done any research on the root cause. They'll say the cause of your pain is fibromyalgia. Well, what is fibromyalgia? Well, fibromyalgia is a group of symptoms that happens together where patients are more fatigued. They have a lot of widespread pain. They have tenderness in certain areas. That's still not giving me a cause. What caused it? Why is your body responding this way? And doing some of these basic things, figuring out toxins, nutrient deficiencies, hormone deficiencies, can help give us clues to why you're having that sort of pain presentation. For some people, the DNA testing that we've suggested previously can be helpful if we're not moving the needle doing other things, because we will find in some of these tests, people with severe pain have really impaired detox pathways that we need to address more aggressively than we do with other people. If they are more prone to inflammation because of genetic variants, then we have more targeted ways based on genes to work around that. I love the DNA testing. In a ideal world, I think it would be great if everyone did it and if they didn't wait until they were having really bad health problems, because what it could do is help us keep you from getting there. I just had, this isn't a pain thing, but I just had a woman who I don't know if she remember if she's in her 60s or 70s, but she's a grandma who did the DNA testing, came in to do results, and she's a very healthy person. She's active, she's healthy, but she's concerned about risk for Alzheimer's because of her mother. It's just a lot of things she wants to avoid, but wants to know how. And it was fascinating with her test. We didn't find any specific risks for Alzheimer's because there is a panel that addresses that. But she had a couple of major risk factors for stroke, which obviously can lead to a lot of cognitive and physical decline or death. But the beautiful thing is, I told her, I said, this is fantastic because regardless of whether or not you did this test, these things were all true. Because you did this test, we know exactly what to do to prevent that from becoming an issue in your life. And that to me is just super exciting. I wish more people were willing to dig deeper into their health before it was a real issue. The parts of our pain program are available other places, but we're grouping them together. One of them is reducing inflammation, and one way to do that is with IV procaine. So, procaine is basically what they'll use, similar to Novocaine that gets used when you have dental work done. So, IV procaine, you have saline, you put sodium bicarbonate into it because what you're trying to do is alkalize things, and then a small amount of procaine. And we work up over 6 sessions till we get to a maximum dose. It takes about an hour, but it's fantastic at reducing inflammation. We've seen it improve even things like incontinence related to pain, sleep related to pain. It's really kind of exciting. And when I was introduced to it, I found out this has been going on some places since the 50s. It's exciting, but it's not new. But it's not a designer drug that you have a pharmaceutical company getting rich off of. And it could lead to long term improvement. And my cynical self feels like a lot of our healthcare system isn't interested in that. They're more interested in things that you're going to have to do again and again and again. So with IV procaine, and you can always do a Google search like IV procaine near me because there are other people that do it. With IV procaine, you need at least 6 sessions, and then we'll do up to 10 depending on what's going on with the person. You have to do them at least like with a day in between. If you're going to get a bunch of sessions close together, you could do it like a Monday, Wednesday, Friday. You couldn't do Monday, Tuesday, Wednesday. But it's exciting, it's well tolerated, and it's very hopeful because reducing inflammation just by taking things like Advil, that's an anti-inflammatory, or even things natural like turmeric, they're great, but they're not getting everywhere. And if we can alkalize things, if we can give a little numbing, just think of the impacts that could have for someone who literally hurts head to toe. The next part of our program is replacing nutrients, which we've talked about in previous episodes, but going through looking at a good intracellular nutrient panel and saying, what is missing inside this person's cells that can be contributing to this chronic pain presentation? Your body can't, well, your body, if your body was a baker, you can't make good chocolate chip cookies without enough chocolate chips. And you can't manage pain effectively with B vitamin deficiencies, with significant antioxidant deficiencies, without enough amino acids to rebuild and repair tissue. That, I think, is a really critical part of healing. Removing toxins. How do you do that? Well, part of that is by figuring out if you have these antioxidant deficiencies. I've had a couple people come back recently who have chronic infections and are doing really good things nutrient wise, but their antioxidant levels were garbage. Alpha lipoic acid, I mentioned, cysteine, glutathione, vitamin C, vitamin E is an important antioxidant. So that's one way that you can help remove toxins from your body is just basically giving it the ingredients that it needs to detoxify on its own. There are also things like sweat therapy using a sauna, and we're going to have a guest on next year to talk a little bit about heat therapy because it's just fantastic. The benefits that it has for pain are really threefold. First of all, it does induce that sweat, which raising your body temperature stimulates your immune system. It increases movement. I mean, I can really when I get in the sauna, I'm like, "Oh, I can move my neck more." Everything stays looser, and I've found when I do it consistently, I try to do it every day, I just have less pain baseline. I'm not chasing pain because I'm doing that, and then the other super important thing it does is help with blood flow. And that's part of how it helps pain too, besides loosening things out, it helps with blood flow. If my husband has a headache, he gets in the sauna and the headache goes away because it's helping restore blood flow. And restoring blood flow is one of our other components. The ways we can do that in addition to sauna therapy are red light therapy, which we're introducing. Red light therapy has a real lot of really exciting benefits and it can target specific areas. That's something we'll dig deeper into on another episode, but it's a lot more widespread as far as availability. And there are even like smaller red light therapy systems you can get online that you can search for. I've seen it help a myriad of symptoms, like not only joint pain, but it's got some benefits for mood. I have one patient who it tremendously helped the tinnitus she had, the ringing in her ear. That made a bigger difference than anything else. So, red light therapy is another thing that we can do to help restore blood flow, which helps get all the healing nutrients and things to the damaged areas so that they can be repaired, that repairing damaged tissues. And the repairing damaged tissues is kind of a subsection of replacing nutrients and restoring blood flow because that's how you're going to repair those damaged tissues. You get the blood there, you get the right nutrients there so that thing could heal. Retraining the body with physical therapy. We have a super fantastic physical therapist here named Truly Moore. Her name is actually Truly Joy Moore. Her main name was Sweet, so she was born Truly Joy Sweet. She is very sweet. She's also has a PhD. She specializes in chronic pain and helping rework the pain pathways. She's very gentle. She does a fantastic job helping people relearn how to move. She's not the pain and torture type of physical therapist. I remember when I worked at a nursing home and we would get calls to get people discharged there for therapy. The social worker would always say they're coming over for some good old pain and torture, meaning physical therapy. She's not one of those. She can really help you rework how to move. The other thing that we're gonna include is neurofeedback that we've talked about because it can help with rewiring pain pathways because pain is caused by injury or inflammation, some sort of insult, but then your body learns pain and it remembers those pain pathways are formed and neurofeedback and other modalities can be really, really helpful for helping rewire your brain. I have one patient who had had a brain injury and an accident. It was either a year or 18 months before, and she had had chronic daily headaches that were pretty disabling since then and had even stopped working. She was working as a teacher before, but she just couldn't because of the headaches. And with neurofeedback, and we only did 20 sessions, they're resolved. They're gone. We were able to rewire that, help teach the nervous system how to calm itself. So it can be really beneficial. The other thing we're going to do is help people relearn how to eat, breathe, and move for health. So, Orlia Alberry works here. She's going to help with the red light therapy, but she also is certified in Yoga Nidra, which is a great thing for you to check out. You can check it out online. She also does virtual sessions if you would be interested. Yoga Nidra is very restorative. It doesn't require movement. It doesn't require ultra flexibility. It doesn't require you to put on uncomfortable clothes or anything. It's breathing. And she discovered Yoga Nidra in her own health journey with chronic infections and does a great job teaching that breathing to others to help them manage stress and to reset the body through breath. It can make a tremendous, tremendous difference. And I'll teach you one little breathing trick that I learned that I found to be the most helpful, which is alternate nostril breathing. And again, it's 2024, so you can go on YouTube, you can go on the internet, you can find videos for this. But alternate nostril breathing, I've found to be super therapeutic, and you can do it anytime, anywhere, even for a few minutes. It really helps my body. What you do is you press on one nostril, you take a slow breath in through the other, you hold it, and then you switch. You press the nostril that you breathed in, so it's occluded. You breathe out through the other one. You breathe in, and then you switch back and forth. Something you wanna look up a really good video on, but that's a super simple technique that can be very, very helpful. Sometimes my husband catches me doing it. He's all, "Are you okay? You're in there doing your breathing thing." But sometimes it's just your body's tense, your mind's going different places. Taking 60 to 90 seconds to do a few rounds of those breaths can really, really help. The other thing we're gonna focus on with the health coaching is making realistic goals for activity levels and for diet changes. It really easy for someone to come in and say, you need to be on an anti-inflammatory diet and you can never have sugar, dairy, or gluten again. But most people aren't going to be able to go home and make that wholesale change. Plus, they have families they're cooking for. They have cultural limitations depending on their culture, whether it be a religious or ethnic or family culture where certain foods are expected and part of things. And if you're coming because you're in pain, you're also tired. You don't have a lot of energy to give to relearning how to cook and eat, and the stress of do I have so many people who want to like to make things for themselves and different things for their family. It's just, it's too much. So Orly is going to work with you. And there are health coaches all over the country now and internationally on making specific, small, sustainable changes. There's a scripture I love that says, by small and simple things are great things brought to pass. It really is the tiny changes, figuring out each week one thing you can do a little differently. And honestly, sometimes there's low hanging fruit, like the patient I had who was drinking 8 cans of sugar soda a day was able to really quickly bring his blood sugar down by not doing that anymore. Sometimes there's not low hanging fruit, but if we look around and you can be honest about your life, what you eat, what your values are, what's important, we can help you. I mean, better to change 5 small things that you can keep doing in perpetuity than to set yourself up for failure with a lifestyle change that you don't have the emotional, intellectual, financial, or social resources to sustain. We also want to help people have really realistic expectations about movement. It seems like, and part of that comes through physical therapy, but also coaching through what can you do at home to move more. You know, if you're not going to go from 0 to 60 and go from being completely sedentary to, working out 60 minutes a day, lifting weights, doing cardio, that sort of thing. But everybody can do something. And with lack of movement, it's just a vicious cycle with pain. You hurt, so you don't move. But the less you move, the more you hurt for multiple different reasons. You've got deconditioning, you've got decreased blood flow. So all of the blood that goes to our lower body comes back up through a skeletal muscle pump. So as you move, your muscles contract and that squeezes the blood, helping get it back up to the heart. So as you are more sedentary, you're going to have more pain, partly because of decreased blood flow, plus deconditioning a lot of things. And I think a lot of people are just confused and overwhelmed and feel like, I can't, I can't exercise. I'm in too much pain, but I can guarantee there are things you can do. And we want to help work with people one on one to figure out small, sustainable changes that they can make and they can build on. And we are going to offer this in a couple of different formats. We do have patients who travel. So we're going to offer one format where you can actually come to us. We could help you find local accommodations stay here for like 2 weeks and do an intensive treatment, or for people who live closer, we can have that spread out over a longer period of time. But I personally am super, super excited because I realized I've been trying to spend a lot of energy helping people learn about neurofeedback, and what neurofeedback could do, or even some of our IV nutrients, knowing this could help people. But it just occurred to me, and it was a real blessing. I had this kind of flash of insight. First of all, that's all. It's a lot harder to explain neurofeedback than to say, "Do you have pain? I can help your pain." It's easier to educate people, but I realized we have so many things right here available that we could do that could really help improve people's quality of life. And think about that. If you can make permanent changes that can help improve your pain so that you can exercise more, get on the ground and play with your grandchildren, stay up longer because you're not exhausted so that you can read that book or do things with friends. It's just so exciting to me the impact we could have on quality of life by helping get to the root cause of pain versus just temporary fixes. And then unfortunately with pain management, and we do have some great pain management doctors out there. There are some really good ones who are really doing their best to help people. But when you're not getting to root cause, people keep coming back because the pain's gone, and then they get labeled as drug seeking. But in my experience, most people aren't drug seeking, they're seeking pain relief. And so if they ask about medications because they don't want to hurt, but people get labeled, and it's just, and then I hear all this judgment that gets passed on people who do take pain medication that is prescribed, and some of these people are just trying to survive. Really don't judge if you haven't been there. If you don't understand what that's like, be grateful because that means you haven't lived it. The other thing we're going to do at the end of the program, we're going to recheck labs like the inflammatory markers. We're going to help people know what to do for nutrient replacement long term once the program's done. And we're going to recheck nutrient labs in 6 months. So we see if we've got everything kind of square. But I'd love for you to message us or call and leave a message on the podcast line with specific questions you have about pain. Remember, I can't treat you, but if you have questions about different types of pain or root causes of that pain, or if you have suggestions or ideas of things that have helped you that we haven't mentioned, I would love to hear about it because chronic pain can get better. For everyone, is it going to go 100% away? No, we don't have that power, but it can improve and you can have improved quality of life. Remember to have hope because you were made to be whole. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686.